Hello. Teaching in an inclusive classroom can be a rewarding and challenging experience. In my experience, the level of success achieved by the inclusive student often relates to the educational training in theory and practice by the teacher. I hope my presentation will give you a deeper appreciation of inclusive education from the perspective of the teacher. In order to understand the extent of professional development needed for a teacher to be effective in guiding a student with a disability, I will take you through a fictional case study based on a student who was diagnosed with two separate disabilities in a short period of time. Teachers are consistently being placed at the front lines of reading, interpreting, and implementing IEPs of students with diverse and sometimes conflicting disabilities, even though their professional background experience does not align with expectations placed upon them. This case study, paired with supportive articles from Ashby 2012 and Purdue, Ballard, and MacArthur 2001, will give you a glimpse into the often confusing and challenging scenarios teachers are faced with on a daily basis. This case study is called The Curious Case of George, a case study of ASD or language delay. Throughout the case study, I will give you the opportunity to reflect on personal experiences related to the topic by answering a few questions. Experiencing a balance of theory and practice are critical to grasping the complexity of diagnosis and impending action by the teacher. Ashby 2012 states the importance of integrating a disability studies framework into pre-service teacher preparation for inclusive education is used to enrich teacher preparation with specific examples from one program. This case study is an example from one such program. When a teacher is first introduced to a student, specific information is analyzed for assessment and to organize strategies to guide the student. As you can see from George's student profile, he was the firstborn child in his family. He has a history of speech and language regression. He also has problematic behaviors. He has a restricted use of language and appropriate interaction at preschool. And he finds it difficult to follow routines. He spins and flaps arms when excited. And George is a full-time student within an inclusive classroom. At George's current school, prior to enrollment, all students must participate in a play-based interview with a classroom teacher and administrator. How the student responds to certain questions, how they organize manipulatives, and how they demonstrate age-appropriate skills is analyzed by the teacher and the administrator. From the interview, a recommendation can be made to the parent for further testing by a third-party source so the school can meet and make arrangements for the needs of the student. This is how George was first diagnosed. During his first year of school, George's teacher suspected his first diagnosis may be incorrect, hence the second diagnosis. Reflection question number 1. What do you know of George thus far? Do you have a specific student that mirrors George? Just take the time right now to reflect on your personal experiences that you may have had with a student that may meet the same criteria that George has. How are ASD and speech language delay similar or different? Here, we see the larger picture that captures the differences and similarities between the two diagnoses which are viewed in the slide. To an inexperienced teacher, the differences may blend together and appear to be one of the same. Teachers who advocate on behalf of their students need to be interdisciplinary to understanding the two diagnoses and implement strategies to guide the student. On the left side of the slide, you can see that ASD, autism spectrum disorder, and the characteristics of it: social skills, speech and language, restricted behavior and play, sensory problems, emotional difficulties, uneven cognitive abilities. On the right side of the screen, we see signs and symptoms of speech and language delay, which are failure to meet developmental milestones for language development, the inability to follow directions, language development that lags behind other children of the same age by at least 1 year, slow or incomprehensible speech after 3 years of age, difficulties with syntax and articulation. Ashby 2012 describes interdisciplinary teachers as teachers who desire to be special education specialists. They also desire to be in general elementary education. A blend of both disciplines generates meaningful planning when considering George's needs. Classroom behaviors can be directly linked to set routines in a classroom. Routines are foundational in creating an environment of safety, both physically and emotionally. Routines allow for all students to practice specific skills and understand the flow of the day. Here you can see where George struggles with some of the daily routines. He struggles to sit during listening time. George can follow directions for up to 5 seconds, or sometimes not at all. George is not very flexible with the routines. For example, if his class teacher forgot to change the daily schedule on the wall, he has to change it during Mandarin time. George repeats the instructions over and over. An example of this is if a teacher says, "Sit properly," he will repeat that to himself. George sometimes wanders around the classroom during listening time. Another contributing factor to George's classroom behavior is the language. Here are 4 examples of how George struggles in his language development. He has a very short attention span when learning language. His number counting is a daily routine, and he can count to around 30. He can say some of the words with one-on-one support, typically with a teaching assistant, maybe only 2 syllables at one time. His pronunciation of these syllables and of his language is not clear. Social interaction makes George's difficulty with articulating how he feels and expressing himself verbally, contributing to a social situation where he makes no eye contact when you speak with him. George typically follows 2 to 3 classmates around the class. He will leave his chair, go to classmate's seat, grab their neck, and pull them down onto the floor. This is George interacting socially without using his language. George doesn't usually play with his peers very often, and he often runs or smashes into the students he likes. Reflection question number 2. Purdue, Ballard, and MacArthur 2001 found in their study that early childhood disabled children were deemed to be different and belonged elsewhere. Having learned more about George's language and social abilities, I now ask, to what degree are social influences, interactions, contributing factors to George's classroom and social behavior? I'd like you to take this time right now to reflect upon this question, now that you know more about George and his abilities. Now that we know more about George's abilities, let's look at a few strategies that can be utilized. One such strategy are social stories. Social stories can be used to teach about social situations, allowing George to understand the meaning of his behavior rather than simply changing his behaviors. Ashby 2012. Also, social stories. They help to prepare for upcoming events, such as an assembly during school. And an example would be a nap time routine, setting up a cot, his blanket. You can also use social stories to teach George how to keep hands to himself. A second strategy are daily routines. We touched on this earlier. However, implementing consistent routines that George can rely on to feel safe in the classroom and ensure there are few surprises during the day are vitally important to his engagement. As you can see on the right-hand side of the screen, there's a visual list of tasks and activities. Also, you can make the schedule part of the morning routine. You can ask for George's valuable input into the routine, make him a part of the class. Also, you can have a TA sit with him at a table during a quiet activity during listening time. It is important to use proper language that are consistent, short sentence structures when giving instructions to George. During announcements or instruction time, concise language benefits all the students in understanding exactly what is expected of them in that moment. Social interaction strategies that can be used with George would be to ask him to look at you when you are speaking. Also, social stories about friends, talking about how to play with one another, will help out George as well. Doing this gives behavioral language modeling while he is playing. Role-playing personal space in different situations will also help George to learn more about social interaction. Documenting assessment and general observations are important, as this is an ongoing project with parents, doctors, and the teaching staff. Having now completed the case study on George, there are a few discussion questions I would like you to reflect upon. Number 1, why might there be different outcomes in the diagnosis? How does this inform your decisions regarding support? Number 2, how can parents and school work cooperatively to help George? And number 3, what other supports could be put into place? My hope is that through this particular case study, you have seen the importance of pre-service knowledge of theory and practical experience to help guide educators when assessing and implementing effective strategies. Minimum teaching qualifications, enhance student learning, and allow for the timely implementation of strategies. And finally, education in all forms must be seen as a part of life, not just getting on with it. Thank you.